The heart of the At Home programme is all about starting with a person and working backwards from that and from their perspective, centring what we do and what matters to the individual.
It's bringing all of our services together, using all of our skills to create a community support service that wraps around the person, their family, provides prevention, information, advice, but acts very quickly when people start to fall into crisis, so that crisis does not become a statutory problem in the long term.
It's simple so that they don't have to try to navigate a really complex health and social care system. There's a way that they're able to make one contact.
The At Home programme is all about enabling people to live a healthier and more independent life within their own home setting.
When you're acutely unwell or you have an urgent need for an operation, then a hospital is the right place to be. But in other settings, where you're recovered from that operation, home is best. Home is where people stay most able. Home is where they're close to their family and friends. And so we know that's best for people.
Mindsets are changing, the understanding of the importance of being able to shift our services into the community, and I think that sort of culture is shifting.
It makes a real difference to those patients that would turn up maybe week on week to GPs with a number of concerns, but will have some form of resolution that could be found from the local authority or from a third sector organisation.
Either signpost them to an appropriate service or to actually deliver the service themselves via an assessment.
And we're taking into consideration what the person's wants and needs are and not assuming what those wants and needs are. And I think that's probably a very different dynamic than we have done previously.
The really good lesson learned from this work, I suppose, is just how useful and valuable having relationships across services has been.
I think previously there's always been some concern that community services weren't sufficient in terms of capacity to manage people in their own homes, but I think the At Home programme has changed the focus of that.
And not only do patients benefit, but we benefit as staff as well. It's much more rewarding and satisfying day when you know that, well, I can actually sort this problem out, rather than 5-10 years ago, the patient would come and see you in a 10-minute slot in GP surgery and all you'd have was either referral to hospital or a prescription. We've now got a much broader suite of things to support people to stay well.
The data is showing us that the outcomes for that individual by staying at home and receiving that care and treatment at home are much more improved for those that actually do require admission to hospital. One of my GP colleagues who's been in the game a bit longer than I have says she feels like she's got a superpower now that she didn't have before, and it definitely gives you a wider range of options to support your patients.